Have you ever wondered what depression feels like? Or if you have depression, do you struggle with describing how it feels to others? What most people don't understand is that depression is much more than having a bad day or an off week. It's a mood disorder that causes constant feelings of sadness, disinterest, and emptiness. Because it affects someone mentally, physically, and socially, most people don't have a good understanding of what it feels like. So to try to describe what it's like to give you a better understanding of depression, here is how some may experience depression on a daily basis. Number 1, waking up exhausted and drained. Have you ever stayed up really late and woke up feeling awful? Imagine that, but every day. Oftentimes, regardless of how much sleep someone with depression gets, they'll wake up without any energy. This lack of energy makes it hard for them to get out of bed and do daily tasks that seem automatic to people without depression. You can think of depression as an invisible weight that brings you down everywhere you go. You may not be able to see it, but it's always there, making life harder. Number 2, feeling as if there's no joy in life. Have you ever tried to pay attention to a class you didn't enjoy at all? Time seems to go slower, and all you can do is count the minutes until it's over. People suffering from depression might feel as if there's no joy or pleasure in their life at all, making them uninterested in everything, in everyday life. Everyone has a hard time concentrating on things they don't enjoy, such as homework or chores. But what happens when someone doesn't enjoy life in general? Likely, they'll become unresponsive and unfocused on the world around them. So far, do you relate to these 2 points? Psych2Go is about encouraging people to open up about their struggles. Comment below your story if you relate to this, and we'll highlight the most impactful one in a future video. Your story helps others. Number 3, low self-esteem. Do you compare yourself to all the models and influencers on social media? People with depression often do the same, but on a much larger scale. It goes much deeper than thinking that their body isn't picture perfect. Instead, they'll relate it to thinking that they're a failure as a person, family member, friend, and everything else. They may see everyone around them living happily and think it's their fault that they're struggling. Of course, that isn't the case, since depression is no one's fault. But just like trying to stop comparing yourself to social media, trying to stop thinking you're a failure is extremely difficult. Number 4, complicated relationship with food. Do you ever eat because you feel sad, bored, or lonely, even though you're not hungry? Much like eating to pass time, people suffering from depression may use food as a coping mechanism. They could overeat to distract themselves from how they feel or to avoid feeling numb. Or, on the other hand, some with depression may also undereat. They may feel too numb or uninterested to the point where they see all food to be unappetizing. In cases like this, it's important you avoid phrases like, "You should be grateful you have the option to eat," or "You're taking what you have for granted." Instead, you might wanna listen to why they're not eating healthily and try to keep in mind that it's not something that can be fixed overnight. Number 5, everything feels hopeless. Do you ever feel like things will never get better? Whether pandemic related or not, everyone can think of a time where they felt helpless and hopeless. But people with depression feel hopeless, not just about the state of the world, but about themselves as well. They may think they'll never amount to everything or that they'll never learn how to cope with depression. This constant state of hopelessness can lead to them feeling exhausted and unmotivated all the time. Number 6, unhealthy sleeping patterns. Ever had trouble sleeping? Maybe you were tossing and turning because you were nervous about a job interview in the morning. Many people with depression struggle with this every night. Depression is sometimes linked to other struggles such as insomnia and anxiety, both of which make sleeping even harder. On the other hand, someone with depression could also sleep too much as well, since they may see it as an escape from their daily struggles. Either way, having a healthy sleeping pattern is important for your mind and body, and without one, you're more likely to feel exhausted, irritable, and stressed. And number 7, physical pain. Imagine the worst headache you've ever had. Now imagine getting that around once every 2 weeks. While many people think mental and physical health are completely separate, they actually overlap in many ways. For example, people with depression are more prone to body aches, headaches, nausea, and muscle tension. So while you may have trouble understanding the complex thoughts and feelings people with depression have, you may be more able to empathize with them.
Hello everyone, my name is Nick Amira and thank you for being part of this session. Today, we are going to talk about mood disorder, what everyone should know about this disorder.
In this video, we're going to discuss about what are mood disorder, type and symptom, case example, cause and risk factor, impact on student, stress, burnout and anxiety, mental health awareness, stigma and how to overcome, treatment, and finally, conclusion.
Now, I will introduce you my teammate, which is Rina Shafika, Izzati Shazwani, Izhan Hanif, Nurin Alia, and Nur Atira.
Let's begin with a simple idea. Everyone experiences emotional ups and downs. Maybe you have had a rough day and felt sad, anxious, or unmotivated. That is normal. These feelings usually come and go, especially when something bad happens or when you are stressed. But mood disorders are different. A mood disorder is when these feelings, like deep sadness or extreme mood swing, last much longer and start to interfere with your daily life. They affect how a person thinks, feels, behaves, and even how they see themselves. To help you understand better, let's compare normal mood changes with a mood disorder. Normal emotions are usually short term. They often have a clear reason and they don't stop you from functioning in your daily life. On the other hand, mood disorders are long lasting. They can appear without any obvious cause and they can seriously affect a person's school, relationship, sleep, and even physical health. Imagine feeling hopeless, exhausted, or emotionally for weeks or months. That's not just a bad day. That could be a sign of a mood disorder. You might be wondering, how common is this? According to the World Health Organization in 2019, 1 in every 8 people in the world, that's around 970 million people, were living with a mental disorder. The most common types were anxiety and depressive disorder. And when the COVID-19 pandemic hit in 2020, things got even worse. In just 1 year, there was a 26% increase in anxiety disorders and a 28% increase in major depressive disorder. Even though there are effective prevention and treatment options, most people do not get the help they need. Many experience stigma, discrimination, or even human rights violations simply because they are struggling with their mental health. That's why awareness is so important, and that's why we are here today. There are many types of mood disorder, but the two we will focus on are major depressive disorder and bipolar disorder. Major depressive disorder are also called depression, involve intense sadness, loss of interest in activities, low energy, and feelings of worthlessness. It's more than just feeling down, it's a serious condition. The second one is bipolar disorder, which is when someone experiences extreme mood swings. They might feel overly excited, confident, and energetic during a high period known as mania, and then crash into a deep depressive state afterward. This shift can be very disruptive and confusing, both for the person and the people around them. Let me share a short story to make this more relatable. Aina is a 17-year-old student. She used to be a cheerful, active in class, and loved to draw. But recently, she's been skipping school, staying in her room, crying often, and avoiding her friends. She doesn't enjoy drawing anymore, even though it was her passion. She keeps saying she's a failure, even though her grades are fine. So what does this tell us? Aina might show signs of depression. Her mood changes are not just emotional reaction to a specific event. They are deep, long-lasting, and affecting her daily life.
In this part, I will talk about 4 disorders, which are major depressive disorder, MDD, dysthymia, or also known as persistent depressive disorder, PDD, bipolar disorder type 1, and also bipolar disorder type 2. We will go into the symptoms, the duration of symptoms, and also the treatment that we will use to treat these 4 disorders. For the first part of this comparison, I will talk about major depressive disorder or MDD. What is major depressive disorder? Major depressive disorder is a condition that is characterized by persistent low mood, lack of energy, and also absence of pleasure. Risk factors associated with major depressive disorder MDD include personal or family history of depression, having chronic illness, and also being female. More info, study shows that unmarried individuals are higher risk in major depressive disorder MDD as opposed to people that are married. In addition to persistently sad mood, signs of symptom of major depressive disorder MDD are loss of interest in activities, weight loss or gain, suicidal ideation, and feeling of worthlessness or guilt. Diagnosis of major depressive disorder MDD is indicated when a person have 5 or more depressive symptoms for 2 weeks or more. The treatment that will be given to the person that have major depressive disorder MDD are antidepressants medications and also psychotherapy. Next, we will move to dysthymia, or also known as persistent depressive disorder PDD. What is persistent depressive disorder? Persistent depressive disorder is a long term of depression. PDD is less severe than major depression but more serious and is longer lasting in duration. A persistent depressive disorder PDD is characterized by continuous feelings of hopelessness and sadness. These feelings makes you feel an overall feelings of low self-esteem, lack of concentration, fatigue, and change in weight. The disorder may begin in childhood, adolescence, or even adulthood, and this disorder is more common in females than males. For a person that have persistent depressive disorder PDD will experience never without symptoms for 2 weeks or more over 2 years period. And the treatment that will be given to a person that have persistent depressive disorder PDD are talk therapy and medicine. The last part of this comparison, I will talk about bipolar disorder type 1 and bipolar disorder type 2. Both of it have the same symptoms, which are decreased need for sleep, irritable mood, racing thought, talkativeness, and increased energy. The difference between bipolar disorder type 1 and bipolar disorder type 2 is the duration of symptoms. A person with bipolar disorder type 1 will have extreme mood swings for a week or more, while a person that have bipolar disorder type 2 will experience less intense elevated mood and have episodes of depression for a week or more. The treatment that will be given to the bipolar disorder type 1 are mood stabilizers and antipsychotics, and the treatment for bipolar disorder type 2 are antidepressant and talk therapy. To make sure you guys more understand about bipolar disorder type 1 and bipolar disorder type 2, I will end this comparison of disorder with a video that explains about bipolar disorder type 1 and bipolar disorder
Bipolar 1
type
disorder typically begins around age 18, although onset can occur at any point in someone's life. A person with bipolar 1 disorder will experience manic episodes that are present for at least 7 days and can be so severe that the person may require hospitalization. The person may also experience major depressive episodes or symptoms, although some people with bipolar 1 may only experience mania without any depression. A person with bipolar 2 disorder will experience episodes of both major depression and hypomania. The symptoms of hypomania are the same as mania, but they are less severe and only last up to 4 days rather than a week.
Next, I will take part. So, why students should take this matter serious? Topics like major depressive disorder (MDD), bipolar disorder, and dysthymia are important for students because they are closely related to mental health, which affect every part of student life. Many students face emotional challenges such as stress, anxiety, or sadness during the academic journey, and learning about this condition this disorder can help them recognize early warning signs in themselves or their peers. Moreover, educating students about this condition helps to reduce stigma surrounding mental illness. This creates more open and supportive environment where people feel comfortable talking about their struggle and getting support they need. When students understand this connection, they can take better of their well-being and build stronger, healthier social life. In the long term, learning about this topic develop important life skills such as empathy, emotional intelligence, and self-awareness. This quality not only helps students in school, but also prepare to be thoughtful, realistic individuals in the future. In matriculation, of course, dealing with pressure are ordinary thing. We must to study hard, get a good result, and prepare for university. And sometimes all of these turn to stress. So we must to know what is hierarchy of stress. Now let's start with stress. We all feel stress sometimes. That's normal. That is natural response to challenge or pressure, short-term and manageable. But constant or instant stress starts to wear you down. But if the stress continue for too long, this become burnout. This is when you feel really tired all the time. You lose your motivation. You don't want to enjoy the things like you used to like it. You might feel sleep too long or too much or too little, feel angry and sad for no reason, and even you feel like giving up. If burnout continue, this can lead to anxiety disorder. Symptom is like excessive worry, panic attack, and insomnia. Your body and mind stay in states of alertness even without a clear threat. What is example that lead to stress? First is high expectation. A student faces pressure from family to achieve top grade while also trying to meet their own goals. The constant worry about disappointing others causes anxiety and emotional exhaustion. Second is overcommitment. A student takes too many extracurricular activities, clubs, volunteer works alongside a full course load. The lack of downtime makes it hard to recharge and resulting in chronic fatigue and burnout. The third one is poor time management. The student procrastinate and cram before exam, causing instant stress and sleepless night. This cycle repeats every semester, wearing down their mental and physical health. And the last one is social isolation. The students struggle to balance schoolwork with maintaining friendship. Feeling lonely and unsupported increase stress level, making it harder to cope and eventually leading to burnout. So, why mental health awareness important? Because many students don't realize that they are going through this serious. They think it's just a stress or maybe I'm just lazy. But actually, this could be earlier sign of mental health problem like anxiety or depression. If we know this sign early, we can get help faster and we can prevent this thing from getting worse. Now, let's talk about something that makes this harder, which is stigma on mental health. When people judge or treat someone unfairly because of their mental health struggle, stigma can make people feel alone, scared, or ashamed, and it stops them from getting support they need. In our society, some people still believe that talking about mental health means you are weak or crazy. That's not true. Taking care of your mental is just as important as taking care of your physical health. If you had a fever, would you like to go to clinic, right? So, if your heart and mind are hurting, it's okay to talk to someone and ask for help. Because of this stigma, many students choose to suffer in silence. So, how to overcome this stigma? First, we can talk openly about mental health, especially in public, to help break down this stigma. When more people share their experience with stress, burnout, or anxiety, it shows that these feelings are common and nothing to be ashamed of. This makes it easier for others to speak up and ask for help too. By talking about mental health, we create a safe and caring environment where everyone feels understood and supported. Second one, get help early when you feel stressed and overwhelmed. It is very important because stress can build up over time and lead to burnout and anxiety. When you reach out early, you can learn ways to manage stress and protect your health. Talking about how you feel and asking for help not only help you, but also help others by showing them it's okay to talk about mental health. Together, we can make mental health a normal part of life, just like physical health, and make sure that no one to struggle in silence. And remember, it's okay to not be okay, but not okay is pretending to be okay.
As I mentioned earlier, mood disorder are mental health conditions that significantly impact a person's emotion. Now, let's take a closer look at some of the common symptoms associated with this disorder. By recognizing the early signs, we can help ourselves or those around us to get support as they need as soon as possible. Mood disorder like depression or bipolar disorder cause intense emotional change that affect daily life. The symptoms can be emotional, physical, and behavioral. For example, you might feel constantly sad, tired, or start avoiding friends. Early recognition is important to get the right support before things get worse. Emotional symptoms are the most common sign of mood disorder. You may feel deep sadness that does not go away even after something good happens. There are also a sense of hopelessness, like nothing will never improve. Mood swing, irritability, and feel overwhelmed are also strong indicators. These most affect how we think, how we interact with others, and how we see ourselves. Mood disorder also show up in our body. Feel tired all the time, even after rest, is the major sign. Some may have trouble sleeping, either too much or not enough. Others experience unexplained body pain like headache or stomach ache. These are real symptoms caused by stress and chemical change in the brain. Behavioral symptoms. Some with mood disorder might start avoiding people or skipping classes. They may lose interest in the thing they used to enjoy, like hobby or hanging out with friends. You might also see changes in self-care, like not eating properly. These signs can be misunderstood as laziness, but they are actually cries for help. Ayman is 20 years old. He is always tired, skip classes, avoid friends, and has lost interest in his hobbies. He also missed 2 assignments. What symptom can we see here? Emotionally, he is lost interest. Physically, he is constantly tired. Or behaviorally, he always withdrawing and avoiding his responsibility. Ayman's story shows up how mood disorder can silently affect someone. Lastly, mood disorder can seriously affect how a person feels, thinks, and behaves. The symptoms may appear in a different way, emotionally, physically, and behavior. Emotionally, some might feel persistently sad, hopeless, or easily irritated. Physically, they may experience constant tiredness, trouble sleeping, or unexplained body ache. Behaviorally, they might avoid social interaction, lose interest in the things they used to enjoy, and neglect their responsibility like schoolwork or daily tasks. It is important to understand that these symptoms are not just signs of being lazy or having a bad day. They are real and it can impact a person's daily life, academic performance, and relationship. That is why recognizing these signs earlier is very important. If you or someone you know is going through this, talk to someone you trust. You're not alone, and getting help in a smart and brave decision. Remember, mental health is just as important as physical health. Making small steps to care for the emotional well-being can lead to the big change in your
Hi,
overall
my name is
life.
Rina Shafika and I will talk about the cause and risk factor of mood disorder. So, there is 3 risk factor of mood disorder. 1. Biological, 2nd. Psychological, and 3rd. Environmental. So, let's focus on one. We're going to focus on the biological factor. Okay, in biological factor, we have brain chemistry or brain chemicals that can regulate mood. We have 3 familiar neurotransmitters that regulate mood. First of all, we have serotonin. Low level of serotonin linked to feeling of sadness, fatigue, and even can increase our anxiety. Second, dopamine. Dopamine is known as feel-good neurotransmitter and it's heavily involved in motivation, pleasure, and reward. It helps to regulate our movement, learning, and emotional response. The third is norepinephrine. Norepinephrine known as body fight or flight. It can increase heart rate, blood pressure, and attention. Other than that, norepinephrine can also help our body to react to stress. For the second factor, we need to be more focused on psychological. In psychological, we have 2 main issues, which is trauma and stress. So first of all, trauma. Trauma can disrupt emotional regulation and cognitive processing, which is it lead to lasting psychological struggles that cause mood disorder. Trauma survivor may develop avoidance behavior, suppress emotion, or engage in harmful coping mechanism. For the second factor in psychological is stress. Chronic stress can weaken mental resilience and increase the risk of mood instability. High stress level will activate the brain's fear response, making individuals more prone to anxiety disorders. We need to talk about environmental. In environmental, we have 3 important factors. First of all, family, school, and social media. Let's talk about family environment. Growing up in a high conflict or emotionally distant family can increase vulnerability to depression and anxiety. Other than that, family that pressure children with perfectionism or excessive demands can lead to chronic stress and self-doubt. Second, school. Constant stress from grades and competition can lead to burnout, anxiety, and self-esteem issues. Other than that, a rigid or unsupportive school system may fail to provide psychological resource for struggling students. Okay, so let's talk about social media. The comparison culture on social media can increase the feelings of insecurity that can lead anxiety disorder. Other than that, the addiction and overstimulation, which is this generation always depend on screen time that we know can disrupt sleep and emotional regulation that can be more worsening for mood disorder. I want to be more focused on one of the case study on mood disorder. Okay, this example will be more specific on how the cause and risk factor will cause mood disorder. Okay, so for the first case study, we need to more focus on major depressive disorder or MDD. Okay, so the patient is just 35 years old and a high school teacher. He always feels exhausted all the time and he complains that nothing makes him happy anymore. The persistent low mood and frequent absence from work make him realize that maybe something bothering him. Other than that, the unintentional weight loss and lost interest in everything that he do lead him to major depressive disorder or MDD. So for life events that occur within his life is the death of his father 6 months ago from a heart attack and increased work stress and administrative pressure. Other than that, we can see that social withdrawal and conflict with his partner cause the mood disorder. We can conclude that not only psychological and biological factor that can cause mood disorder, but we can see that environmental such as family, our loved one, can lead to major depressive. So for the second case study is for bipolar disorder, and we need to focus on type 1. The patient is just 28 years old and working with creative agency. She always feel like she can fly or sometimes can't get out of bed for days. She always feel like lack of energy and struggle to sleep. The signs that show that she is not alright is when she feel like she is on the top of the world. So, for the life events that occur within her life is when her mother is diagnosed with bipolar disorder type 2 and paternal uncle died by suicide. In this case, we can conclude that environmental is a huge cause and risk factor that causing someone into mood disorder. So last but not least, I can conclude that biological, psychological, and environmental will play a huge and big risk factor that can lead someone into mood.
No one cares about what you're doing. It's about who I am. Being okay with where I am. I am grateful to be alive.
Selena Gomez
was diagnosed with lupus, depression, and anxiety.
She had a mental breakdown.
Let me make a promise. I am going to stop living like this. How do I learn how to breathe my own breath again?
If anybody saw what I saw, they wouldn't have recognized her.
Like my whole life since I was a kid, I've been working. I don't want to be like super famous, but I do know that if I'm here, I have to use that for good.
What's holding you back from doing it?
That I'm not good enough. That's something that I've felt a lot of growing up.
In this life, you have to show people empathy, have a chance to give people more than what you receive.
What makes me happy is connection, and it helps me get out of my head.
Do you know who this is? Yes, she's real. Mommy went to school with her.
Clearly, I'm still here to use whatever I have to help someone else.
We don't get along sometimes. It gets hard to breathe, but I wouldn't change my life.
Everything that I had gone through, it's gonna be there. I'm just making it my friend now. I am happier and I'm in control of my emotions and thoughts more than I have ever been.
I think that you are saving lives. I know that you're saving lives.
Just hope I'm a part of the conversation, you know?
If somebody sees me like this, then they won't feel alone now.
You know, this is the beginning for me.
With how mood disorder affects students. Students with bipolar disorder or depression often find it struggle to focus, complete assignment, or attending classes. This is not because they don't care, it's because mood changes affect their motivation, energy, and concentration. During a depressive episode, even getting out of bed can feel impossible. In a manic episode, someone might be so restless or distracted that they can't focus at all. So, over time, this can really affect grades and academic confidence. Mood disorder also affect relationship. Students might become more withdrawn, avoid friends, or depend too much on family for emotional support. This can lead to misunderstanding. A friend might think, why is she ignoring me? But really, that person may be struggling silently. Even romantic relationship can suffer. Emotional distance or mood swing may cause conflict or break trust. So, this is not just an individual problem. Mood disorder can really affect everyone around them too. Although mood disorders are mental conditions, they can hurt the body too. People with depression often feel tired all the time. They may get headaches, stomachache, or even sleep problems. Some may even neglect their own health, skip meals, avoid exercise, or harm themselves physically. That's why mood disorder is not just about emotion. They affect the whole person's body and lifestyle. Let's talk about treatment. First, medication. Doctors often prescribe antidepressants for anxiety and depression. This helps balance the brain chemicals. For bipolar disorder, mood stabilizers are used to control extreme mood swing. Of course, medication is not a quick fix. It takes time to work and may have a side effect. That's why doctors adjust the dose carefully for each person. Another very effective treatment is psychotherapy, or talking to a trained counselor. One of the most common methods is CBT, cognitive behavioral therapy. For example, if a student constantly thinks, "I'm a failure," the CBT helps to challenge that thought and replace it with something healthier, like, "I'm struggling now, but I can improve." Therapy also teaches skills like how to manage stress, handle conflict, and control emotions. It's not just talking, it's learning how to take back control of your life. In more serious cases, doctors may recommend other treatment. One of them is ECT, electroconvulsive therapy. It uses small, safe electrical pulses to treat severe depression. These options are usually for people who don't respond well to other treatments, and they've helped many people to recover. Mood disorders are serious conditions, but they are treatable. And most important thing is ask for help early. And to remember, recovery is always possible.